All right.
Good morning, everyone. Happy Monday. I hope you all stayed warm here in Southern California or wherever you are in the country, as a matter of fact. Boy, it's crazy weather. So, we're going to talk about advanced maternal age today. I am not looking my finest today. We caught 2 babies this morning, and so I'm a little bit tired, but I'm going to try to be as articulate as possible. So a big question that comes up, whether you're birthing in the hospital or out of hospital, but certainly a question that comes up for people that are thinking about out of hospital is, first of all, am I too old? Am I high risk because I'm going to be 35 when I deliver, or I am 35 or older? A lot of people ask us if that is a risk factor for having a baby out of hospital, because most people are led to believe that advanced maternal age is high risk. And we tell people often, we've been saying it for years, that no, your age does not risk you in terms of birthing your baby. Age does risk you in terms of certain chromosomal abnormalities. But a new study came out, and it sounded like kind of a scary thing. It said women that are over the age of 35 have a 50%, I think it said like a 50% more risk. I think the headline said you have a, giving birth later in life may increase certain pregnancy risks. And it said that it increased your risk by 50% or something, being over the age of 35. But let's break down those numbers. What does that actually mean? So I looked up the study, and I'm just going to break it down and give you some of the layman's terms for it. It said that women over the age of 55 did have an increased risk of certain complications, although overall the risk of the complications remained low. And this is a big question. So we have about 0.5% risk. Women from ages 20 to 34 have about a 0.5% or 0.56%, so half a percentage point risk of having a baby with a chromosomal abnormality. And when you are over the age of 35, that rate goes up to 1.3%. So it does increase to slightly over 1%, which 99% chance you're not going to have a baby with a chromosomal abnormality. But there is a 1% chance you are, due to advanced maternal age, because what happens is we say the eggs get kind of sticky. And so, because you have the eggs in your body, were in your body when you're about 4 months gestation in your mother's body. Wow. Mind blown. So when your grandmother was pregnant with your mother, she had her eggs that enabled her to have you. Wow. Okay, so it's kind of mind-blowing. So the eggs in your body have been in there for a really long time. So we know that as you get older, these things can affect the quality of the eggs. But it only gives you a 1.3% risk of a chromosomal abnormality up to the age of 40. Once you hit the age of 40, it goes up even a bit more than that. It's about 3.5% risk of a chromosomal abnormality, which is, that is not super duper low. It's not 0.56 or 1.3. It is significantly higher than that, but it is still 97% chance you will not have a baby with a chromosomal abnormality. Now, what age does do to us is our lifestyle. It affects how we live as we get older, right? So our age, depending on how we've treated our bodies, we could develop high blood pressure, we could develop diabetes, we could have some other issues, that ultimately, heart disease or something, that ultimately will affect how a pregnancy affects our body, because we're already sort of slightly diminished, given if we've been drinking a lot and abusing food and abusing recreational drugs, and not exercising and things like that. Of course, as we get older, we do develop more risk factors. But if you are a healthy person and you have good blood pressure, you have good blood sugars, your diet is fairly clean, you exercise on a regular basis, then you should be fine in your pregnancy, right? It doesn't risk you significantly in terms of having a problem. So in our practice, in an out-of-hospital birth setting, and I'm sure the majority of midwives would all agree, that you are not high risk because you are advanced maternal age. And you should still seek out, if you want, the support of a midwife so you can have a low, unmedicated, low intervention birth if that's what you want. Just because of your age, you should not be pigeonholed. You do not need extra testing. You might want to do some chromosomal testing if you're going to do something with that information. We've talked about that before, about what tests are available in terms of genetic testing and why do we do them and what will we learn from them and how will it help us move forward. So there are tests that are available, and many insurance companies will cover those tests if you are advanced maternal age, versus if you're under the age of 35 in a low risk category. Many insurance companies will deny doing any of those genetic testings for you. There is the California State Prenatal Screening that is covered if you have insurance, but then there are some private companies. We use Sequinome is the lab we work with that does what's called NIPT, non-invasive perinatal testing. And the cost for that test, if you're under the age of 35 by the time you deliver, can be more expensive than if you're over the age of 35, because there's a special disease code for you if you're over the age of 35. And insurance will look at that and say, okay, well, there's a risk factor, therefore we'll cover that charge. That's what that means. But you could do some more testing if you want, but otherwise you are safe. You're not at an extreme risk. So you should not be treated as a high risk person. You don't need a high risk perinatologist or maternal fetal medicine doctor to be doing all of your care with and delivering your baby, unless you have a pre-existing condition. If you have high blood pressure prior to getting pregnant, you are high risk. If you have diabetes prior to getting pregnant, or you are pre-diabetic, right? Sometimes you get, as you're doing your well-person checks, annually you'll do blood work, and one of the things we're looking for is your circulating blood sugar. And that test name is called a hemoglobin A1C. And if that hemoglobin A1C risks you prior to being pregnant, this is not a pregnancy test, just an annual check. If you're labeled pre-diabetic, you might want to work with a nutritionist, a naturopathic doctor, or your medical provider to get your glucose levels under control so that you do not become diabetic in your pregnancy, right? But age alone is not the factor that would cause you to be high risk. So we're going to add below here some links to what I'm referring to. But the bottom line is, among women who were 20 to 34 years old, 0.56% had a baby with a chromosomal abnormality. So low-risk women still had a 0.56% chance of a chromosomal abnormality. In comparison, the percentage of older women, 35 to the age of 40, had a baby with a chromosomal abnormality. It was doubled, but it only was 1.3% of women 35 to 39. And it was 3.8% of women aged 40 or older that had chromosomal abnormalities. So there's a doctor in New York, and we'll also link that study. He's a maternal fetal medicine guy. And he basically said, we have women currently in our practice that are over the age of 40. Last year we had a few women that were over the age of 40 having their babies. I was just seeing, there's a senator, I believe, in Illinois, and she's going to be 50 at the time that she delivers her second baby. And she's going to be 50. And what this maternal fetal medicine guy says is that if you're healthy, then you should have a healthy baby. Might you have complications in the pregnancy? You might, just like other people might. May you have a cesarean? You might. But otherwise, it's not significant. And currently, the highest number of women birthing in the United States, actually the demographic, is over the age of 40. That is the highest number of women having babies today, which is really astounding, actually. And so women, so women generally can conceive without a problem up to about the age of 41. After the age of 41, sometimes conception can be more difficult. But we know that many women are waiting because they're working, they're maybe part of the, they have careers and they're not ready to give up those careers to have their babies yet. So many women are starting to have their babies at the age of 40 or older. And so it's super cool. And I think
we had a comment that you might be able to address. I'm not sure. On Instagram, we have a comment that is from Love is Love Love. I want a VBAC, but I had 2 cesareans. My boys are now 12 and 10. I'm a healthy 35-year-old, but no one will help me.
Well, that's a loaded question. So
I know, right?
Somebody might not be helping you because A, you've had 2 previous C-sections. But what we know, what the research says, I don't know the reason for your C-section, so speaking generally, ACOG, the American College of Obstetrics and Gynecology, say in their position paper that all women with 2 previous cesarean deliveries deserve a trial of labor. So there's no medical indication for you not to trial your labor because you've had 2 previous cesarean deliveries, and your age has no impact on whether you would successfully have a vaginal delivery or not. If you live in the Southern California area, feel free to give us a call at the office. We could direct you to some providers that would be open to talking to you about whether you would be a candidate to birth at a hospital. It would depend. Do you have other criteria? What were the reasons for those previous C-sections? How were those previous deliveries done? How were those previous cesarean deliveries?
She says, I was a frank breech. The second was just because my first was.
Right. So there's no reason for you not to be able to trial your labor. If you've had a breech delivery for one and then an elective cesarean for a second, you didn't have a complication where both times you were arrested after being complete and pushing, where there was something called cephalopelvic disproportion identified. So you are a candidate to have a vaginal delivery, at least a trial of labor after a cesarean birth. And if you are in our vicinity, we don't do those at our birth center we do them collaboratively with an obstetrician that does out-of-hospital births, and we can certainly direct you to that provider and give you some other resources for providers that work in hospital that would be open to seeing you for a trial of labor. But your age doesn't factor into this, right? 35 isn't a thing. So yes, you should find a provider, and we're going to be happy to help you. And if you don't live in our area, we could probably help you still find a provider. There's a great website called it's Jen Kemmel's. So sorry, I haven't slept yet.
She just had 2 babies come through. So
Jen Kemmel, VBAC facts. You could Google her. We're going to link it.
Yeah, we'll link it on Facebook.
But we should help you. We should be able to help you find a provider in other areas of the country as well. So yeah, your age doesn't risk you for that. That's awful. So there you go. So I just want you to know, because it is a big question that comes up in our office. Oh my gosh, I'm going to be 35 and I deliver. I've been told I'm high risk.
Yep. She's from Northridge, so she said she's going to call.
Yeah, great. Our phone number is 661-254-3000.
It's also in our bio.
It's all in the bio and in our contacts. So do give us a call and we'll help direct you to the right person. So there you go. It's a simple question. It's a question that comes up often. The answer is simple. You don't suddenly, on the day you turn 35, become this crazy high-risk person and all your eggs suddenly go bad. It's just like saying that, on your due date, if the baby's not delivered, all the babies, go bad. Like, it's not a thing. We need to know that birth, pregnancy, there are gray areas. There's lots of parameters around this. So we had a woman last year, I think she was 46. We had somebody who was 44. We had somebody who was 42, and they all did awesome. They all did awesome. Now, we don't have large numbers in our particular practice, but we certainly have a significant number of women over the age of 35. Don't have that many women over the age of 40, but I think I just rattled off 3 people last year over the age of 40. And certainly there are many, many women having their babies with us over the age of 35. So if that's helpful, please share it with your friends. If you hear your friends saying, oh, I'm high risk, oh, I have to be seen more often, my doctor's running all kinds of tests on me because I'm high risk, because I'm over the age of 35, do some research on that, because that is not true.
Okay, we have something from Facebook. A comment from Brendy Header.
Yes.
She says, how can we specifically encourage friends of, quote, advanced maternal age when their doctors are making them afraid?
I would encourage everyone to have an open conversation with their care provider and just simply say, can you show me the research that says that? read some research. There was this study that came out, it was all over Facebook actually, about this advanced maternal age. But when your doctor presents you with something and there's no discussion, you as the consumer, you are a consumer buying medical care, right? You're a consumer, so you can say, can you show me the evidence? Can you show me some research that can point me in the direction of why you're considering me high risk? Can you give me percentages? Can you give me data? I'd really like to learn more about this. It is certainly appropriate for you to engage in conversation with your care provider. Don't take anything at face value. We don't often, we do, again, I've said this before, but we do more research in what kind of phone we're going to get, what kind of laptop we're going to get, what kind of car are we going to buy. I mean, we just research this stuff to no end. Yet when we become pregnant, we go into the doctor's office and they say something to us, we just go, okay. And then we walk out and we don't do any research. There's data out there that is available to you. We have this beautiful thing called the World Wide Web. Now, not everything is true and can be frightening on the World Wide Web. But you want to look at good evidence-based, good data, good studies. And that's the best we can do. But you deserve to have a conversation with your care provider, and it is appropriate for them to give you evidence-based responses.
Yeah. We had Cindy Hen here on Facebook said, I had my last 3 with a great midwife at the age of 36, 39, and 42 with no problems.
Oh my gosh.
2 of them had their babies with you, Renee.
Yes. And they went on to have, everybody is healthy. It's a super duper healthy family. Cindy is just the wonderful woman that makes us that great tincture that everybody loves here for their baby's gas. It's the catnip fennel tincture. She's the one that blends our teas. She is super awesome and very knowledgeable. And yes, Cindy, you're right. Your daughters went on to have healthy babies. Wait, how does it work? Their eggs were inside your body at your advanced maternal age. And you have grandbabies that are perfect. And you birthed perfectly out of hospital with your wonderful midwife. Yes, it's true. So we just tend to be a fear-based culture. And we're a litigious culture. So we do deserve to be pointed to the right direction when our care providers say we can't do something and there's a blanket statement. Say, wait a minute, I don't understand. I need to know more about this. I'm not saying that you should disagree, but engage in conversation in a non-confrontational way. There you go. Any other questions out there?
Just one more comment from Jamie Pullett.
Yes.
She said, yes.
Yes.
In the age of this much information, ignorance is a choice. I mean, she said it.
Ignorance is, it's hard to know for a lot of us where to find the information. We are also, many of us don't have the ability to sit in front of an authority.
Yeah, it's scary.
And say, show me the evidence. I find myself, if I go to the doctor, suddenly I'm like, oh my gosh, I forgot what questions I was going to ask. We're not raised to ask questions to the doctor because they know more than we do. So there are ways to find out the information. It can be incredibly intimidating, but we have to help each other. When we encourage our friends that are advanced maternal age and they say, well, my doctor said, you might just engage and say, well, you know what, there's some research out there. Would you be open to me sharing what the current evidence says about this? Or, hey, my friend is a midwife and she does this podcast every Monday, and I think she spoke about that, and we're going to link the studies to it. All we can do is help share the information and then support our friends with whatever choices they're going to make. Say, look, it's great if you want to follow along with what's being said, but, would you be open to some more information? And then you got to kind of let it go, and we all have to find our own way and try. We're all trying to do the best we can for our babies. So if you are 40 years old and your doctor said you are high risk and that feels okay for you and you're not having a problem with the care that you're being given, right on, do your thing.
Yeah.
But those of you that are like, you have this feeling like, I don't know, why am I'm healthy, I eat great, I exercise all the time. Why is my age a factor? And you feel something deep in your core that says this can't be right, or I'm not sure this is right. Ask the questions. Ask the questions.
Absolutely. Brendy, this is obviously a lot of discussion today. That's great.
It's a big
one. Brendy said, but it's hard when the doctors are saying contradictory things. We need to teach people how to ask respectful and tactful questions. Maybe we should do a Midwife Monday on having an empowered birth.
Yeah, or how to,
whether you go with a doctor or a midwife.
How do we ask appropriate questions when we're in a doctor's office?
It's tough.
How do we go about finding the information? And yeah, so I'm gonna kind of wrap my head around that. Yeah. We also have a topic that we're gonna do. We're gonna invite a guest speaker because somebody asked us to do a topic on exercise and pregnancy, and we were gonna do it today, but it would be much better to have a professional that works with pregnant women. And so I'm going to shout out to our BirthFit people to see if we can get Nikki to come in and do a class or do a Facebook Live on exercise and pregnancy, especially for advanced maternal age. You know, you want to keep your blood pressure low, you want to keep your blood sugars in check, so we should all be exercising. But what kind of exercises? We'll go over that once we can get Nikki penciled in to do a Facebook Live with us on that from BirthFit. And also Kelly Herda, who's our chiropractor here, I know that this weekend she just did the BirthFit professional trainer. So be interested to have her perhaps, chime in on some exercises for our moms.
We had some more. Ryan and Amanda is the name. I think it's probably Amanda. Maybe I missed this, but could you do fertility over 35?
Yeah. If you're ovulating, you could. The issue with being over the age of 35 is it says that your risk for the baby having a chromosomal abnormality increases to 1.5%. Right? Did I say that right? Did I remember that right? 1.5%. Right? Because it was 0.56% and it went up to 1.3% of chromosomal abnormality. Over the age of 41, there are some statistics that say it might be more difficult to conceive. Also, over the age of 40, your risk of a chromosomal abnormality, a baby born with a chromosomal abnormality, increases to 3.8%. But if you are having regular cycles and you're ovulating, you shouldn't have a difficulty conceiving over the age of 35. Yeah, you can still do it. And if you're not cycling regularly, we have a naturopathic doctor that's working in our office, and we're going to do a Facebook Live with her too. Her name is Dr. Strider, and she works out of our office. She's here 3 days a week. She's wonderful. She was practicing up north and has relocated to the Santa Clarita area. And she's a naturopathic doctor. She can work with fertility. She does those saliva tests to check your hormones. And I'm going to do mine next week. And so I'm kind of excited to see where that's at. Because I am 54 years old. And I'm just curious. Maybe I could still have another baby.
You going for another one?
I don't know. Maybe I will. That's kind of terrifying. I don't think I'm going to do that. So there you go. Any other questions out there or comments?
Brendy said, I used to say, quote, I'm so glad you're concerned for me. Can I email you some specific questions and maybe you can send me the clinical studies, end quote. That seemed to help negate the drama. That was great.
Email you some... Brendy, you are so smart. On so many levels, friend. On so many levels, you are such a treasure. That is so great. Because when we're in the moment, we forget the questions. But say, thank you for your concern. I'm going to go home. Can you email me? I'm going to email you some questions. And can you email me some...
clinical studies.
Some studies.
Specific questions, and maybe send me the clinical studies to support.
Send me some clinical studies. That's so great. From anyone. So if I say something like, for instance, the topic of consuming your placenta comes up all the time, right? That's another big question. Should I eat my placenta? And I'm always saying, well, there's no clinical studies that support it. And I could show you the clinical studies. I could also show you the clinical study that says we believe that the consumption of the placenta is a placebo, and the placebo effect in clinical studies is very, very effective. But the clinical studies say that there's no evidence to support it, right? The clinical studies for advanced maternal age, I can share those with you. If your doctor puts out a blanket statement saying, you're too old, you're high risk, show me the clinical studies.
The weight one comes up a lot.
The which one?
Weight.
You're high BMI.
Yeah.
Right? We talk about there's no clinical study that says your high BMI means you're unhealthy. So if we say something in our practice as your care provider and you have a question about it, I hopefully will engage in conversation, and then we upload the clinical studies and we say, look, we're an evidence-based practice. We're an accredited birth center. We have to be evidence-based. We have to support anything we say with clinical studies. And your doctor should be held to that same standard. So that's a great point. And if you're feeling pressure in the doctor's office, say, can you email me those clinical studies? It's awesome.
Perfect.
It's a great way to go about it.
Mary Collins says, Renee delivered my baby at age 46.
Yes.
My age, not hers.
You are 46 years old, Miss Mary, and you had an awesome home birth, and it was beautiful, beautiful, beautiful. Your blood pressure was excellent the whole time. Your blood sugars were beautiful the whole time. There was no dysfunction in your labor pattern. You didn't bleed. It was spectacular. Certainly from my perspective, it was spectacular. And and you weren't my only one that was geriatric last year. Geriatric. Crazy. There you go. I hope that's helpful, you guys. Feel free to continue to comment. And it's awesome talking to all my friends out there that we've had the honor of supporting in their pregnancies. And thanks for joining us. See you next time.